Shoppers' drug marts across the city have been busy this past week as people get their COVID-19 vaccines. But in Toronto's hardest hit communities, that hasn't been the case as you might expect. And that's because not enough pharmacies are offering vaccinations in those areas, leading to fears that the most vulnerable have fallen through the cracks. York University Heights is just one of many neighborhoods in the city's northwest corner with a long history of racial health inequities. It's been no surprise it's had one of the highest burdens of COVID-19 throughout the pandemic.
The marginalization that they've experienced is certainly related to the risk of COVID.
The most recent data compiled by Toronto Public Health shows the neighborhood has 612 active cases per 100,000 people. Yet, only 2 pharmacies in the area are participating in the provincial vaccine pilot project. It's a similar story across the city. Areas of greatest need appear to have less access to the life-saving shots.
When you see it on a map, it's pretty clear that they're really not focused on the most vulnerable areas within our city. This is what systemic injustice looks like.
This bioethicist says the areas that were left behind are vulnerable in 2 ways. They're home to higher concentrations of infection and a higher number of essential workers.
It's not good epidemiologically and it's not good ethically.
Peel Region, a COVID-19 hotspot where essential workers have been fueling the spread, was left out of the province's mass vaccination efforts.
If you have fire extinguishers, use them where the fire is. And that's what these vaccines are. They're fire extinguishers.
And there's urgency to get Peel its fair share of vaccines. The region has the highest positivity rate in the province and has seen the most workplace outbreaks. Yet the pace of vaccinations is notably slower than the provincial average.
I'm being assured from provincial officials that Peel will be part of the next rollout. But that doesn't justify the fact that we're not part of the initial rollout. We have the capacity to do about 70,000 a day. So right now we're just doing drops in a bucket. We've got big mass vaccination centers that are empty. And so that's not right.
Starting Monday, those 60 and older will be able to book an appointment to get a dose of the AstraZeneca vaccine at more than 300 pharmacies in 3 public health units, including Toronto. Premier Doug Ford announced Friday that number will nearly double to about 700 pharmacies across Ontario in the next 2 weeks.
We're reaching a point where we're starting to ask an awful lot of the pharmacies in the weeks and months ahead. And I'm guessing they can rise to a lot of it, but they can't perform miracles.
There is hope that expanding the vaccine rollout to more pharmacies will address the current gaps, but there are calls for the province to have family doctors and community health centres play a bigger role in vaccination efforts. Caryn Ceolin, CityNews.